Hey there! Let's dive into the fascinating world of surgical sutures. Sutures are a fundamental aspect of surgical practice, and understanding them can significantly enhance patient care and surgical outcomes. Whether you're a seasoned nurse or just starting out, knowing the different types of sutures is crucial for patient care. Sutures are not just threads, they are lifelines that hold tissues together, promote healing, and prevent infections. First up, we've got absorbable sutures. These are designed to be temporary, providing support to healing tissues before they naturally dissolve. These are made from materials that naturally dissolve in the body over time. This means they don't require a follow-up procedure for removal, which can be a significant advantage in many surgical scenarios. Types include catgut, polyglycolic acid, and polydioxanone. Each of these materials has unique properties that make them suitable for different types of tissues and healing processes. They're great for internal tissues because you don't need to remove them later. This is particularly beneficial in surgeries where accessing the sutures again would be difficult or risky. You'll often see these used in gastrointestinal or gynecological surgeries. These areas benefit from the reduced need for follow-up procedures and the minimized risk of infection. Then, there are non-absorbable sutures. These are designed to provide long-term support and are used in situations where prolonged strength is necessary. These sutures are made from materials like silk, nylon, or polypropylene, and they need to be removed once the wound heals. This removal process is a critical step in ensuring the wound has healed properly. Non-absorbable sutures are typically used for skin closure, cardiovascular surgeries, and where long-term strength is needed. They provide the necessary support for tissues that undergo significant stress or movement. Next, let's talk about monofilament versus multifilament. Understanding the differences between these two can help you choose the right suture for the right situation. Monofilament sutures are single-strand, making them smooth and less likely to harbor bacteria. Think nylon or proline. Their smooth surface reduces the risk of infection and makes them ideal for certain types of surgeries. They're excellent for cosmetic results but can be tricky to handle. Their smoothness can make knot tying more challenging, requiring more skill and precision. On the flip side, multifilament sutures are braided or twisted, like silk or vicryl. These sutures are easier to handle and tie, making them a popular choice in many surgical procedures. They offer better knot security and are easier to handle, but have a higher risk of infection due to their braided structure. The multiple strands can trap bacteria, so careful handling and proper technique are essential. Now, there's also a choice between natural and synthetic sutures. Each has its own set of advantages and considerations. Natural sutures, like catgut and silk, are derived from biological materials. They have been used for centuries and are known for their excellent handling properties. They tend to cause more tissue reaction and inflammation. This can be a drawback, especially in patients with sensitivities or in areas where minimal tissue reaction is desired. Synthetic sutures, such as those made from polyglycolic acid or nylon, are designed to minimize tissue reaction and offer more predictable absorption rates. They provide consistent performance and are less likely to cause adverse reactions. And let's not forget, each type of suture comes in various sizes, from the thinnest 11, 0 to the thickest 7. The size you choose will depend on the specific requirements of the tissue and the surgical procedure. You'll choose the size based on the type of tissue and the required strength. Thinner sutures are used for delicate tissues, while thicker ones provide the necessary support for more robust tissues. Finally, always remember to follow your hospital's protocols and consult with your surgical team when selecting sutures. Collaboration and adherence to guidelines ensure the best outcomes for your patients. The right suture can make all the difference in patient recovery and surgical outcomes. Thanks for tuning in. Your knowledge and skills are vital in the healing process. Keep those hands steady and those minds sharp. Continuous learning and practice are key to mastering the art of suturing. Until next time, stay awesome, nurses. Your dedication and hard work make a world of difference in patient care and recovery.